Good afternoon, everybody. My pleasure today to introduce Dr. Luisa Giles. She is a newly minted PhD from the University of British Columbia. Her doctoral research focused on the health effects of air pollution exposure during exercise. She has an MSc from UBC and a BSc from Staffordshire University in Kinesiology, and she has worked as a research coordinator in an environmental physiology lab at Simon Fraser University. She has conducted experimental research in the areas of environmental physiology that include exposure to air pollution, hot and cold environments, and hyperbaria. Maybe she'll actually tell us what that means when she gets up there. Luisa currently works as a knowledge translation scientist at the National Collaborating Centre for Environmental Health, an instructor at UBC, and a sports scientist with the Canadian BMX team. Welcome, Luisa.
Just let me know if you can't hear me. And thanks again. I'm really looking forward to telling you a bit about my doctoral research today, and definitely about an area that I'm really interested in and really passionate about. I'll be starting with a bit of an overview and introduction about the state of the research related to exercise and air pollution, and then moving into the focus of my doctoral research. But I just ask that I'm from a physiology background, and I know some of you may or may not be, so this is sort of an open environment, so feel free to throw up your hands or ask any questions as we go through. But from what I understand, there's also a question period at the end of the talk today, but in my opinion, it's quite a relaxed environment, so go right ahead and pop up your hand if you want to. So I took the liberty of changing my title ever so slightly to the physiological effects of cycling or exercising, because I don't think you can disentangle cycling from other exercise, and then also about air pollution in general, but the focus of my doctoral research is diesel exhaust. So we know that in 2010, it was estimated that air pollution contributed to 3.1 million deaths worldwide. On the flip side to this, in the same paper, they estimated that physical activity, so being sedentary, also contributed to 3.2 million deaths worldwide. So from these two slides, what you can get is air pollution is bad, physical inactivity is bad. And so on the flip side to physical inactivity, the World Health Organization estimated that regular physical activity can halve the risk of coronary heart disease, diabetes, and obesity, and reduce the risk of hypertension by 30%. So then why I became interested in this is, okay, well, what happens when you combine being physically active, these beneficial effects of physical activity, in a place of air pollution? And I often wondered was, well, where do the scales sit in terms of, does exercise outweigh air pollution, or does pollution outweigh exercise? And really, right now, we don't. There's a reasonable body of research, but we don't really know whether the effects of exercise outweigh the effects of pollution. But let's take a step back for a second. Why do we even think that exercisers might be at risk when they exercise in a polluted environment? Well, when you exercise, you breathe more. So you have an increase in what's called ventilation. And so if you breathe more, you potentially intake more air pollution. You also shift from breathing through your nose to breathing through your mouth. And some of the pollutants that you could inhale may bypass the filtration system of the nose and deposit further within the respiratory tree. And then finally, you also get an increase in something called airflow velocity, so the speed at which the air moves through the lungs, which can also increase the deposition of certain kinds of pollutants within the respiratory tree. So as an exercise physiologist, these are three things that I am fairly familiar with. So that, I would say, is from a physiologist, a no-brainer. But in addition to this, what happens when you exercise is you get an increase in something called deposition fraction, at least of the particles within the pollution that you're exposed to. So what this graph shows here is, on the x-axis, you have rest in the white bars and exercise in the black bars. And on the y-axis, you have something called deposition fraction. So essentially, that's the percentage of particles that remain in the respiratory tree. So what you can see when an individual is at rest, the deposition fraction is about 0.6 of the ultrafine particles within the air pollution. And when an individual exercises, that goes up to about 0.8. So what that means is that 80% of the particles with which you inhale stay within the respiratory tree. So basically, more is staying in your respiratory system. So what that means is that if for each breath, more stays in there, and when you're exercising, you're breathing more, it means that over the total course of exercise, the total amount of ultrafine particles within the respiratory tree can increase by about 4.5-fold. And so what this is essentially the sum of the particles that are deposited in the respiratory tree over the whole bout of exercise. So it can increase significantly. So then back to this slide, in addition to the three common factors that at least I was familiar with, you get an increase in deposition fraction of ultrafine particulate, as well as an increase in total deposition. So what these 5 factors essentially do is increase the intake and dose during exercise. And so what is generally assumed is that when you increase the dose that you inhale, you may increase the physiological and/or health effects. But the problem with this assumption is it doesn't take into account the acute physiological effects of exercise that may actually counteract some of the effects of pollution. So we know that when individuals are acutely exposed to air pollution, they can experience an increase in blood pressure, their vascular system cannot function as well, and they can also experience bronchoconstriction, which is basically constriction of the airways. But when an individual exercises acutely, they experience something called exercise-induced hypotension, which is a lowering in blood pressure following exercise. So for this particular instance, you have an increase in blood pressure following pollution, whereas a decrease in blood pressure following exercise. In terms of vascular function, following exercise, you have improved arterial distensibility. So your vessels are able to distend better, which could potentially counteract the reduced vascular function of air pollution. And then finally, the following exercise, you get basically a dilation of the airways, which may or may not counteract the constriction that's induced by air pollution. So what I'm trying to do to highlight with these points is that I don't think it's as simple as you intake more air pollution results in more physiological and/or health effects. So I'm just trying to highlight that it's a complex process. It's not a simple linear response. And then finally as well, when you exercise, following exercise, you may actually retain less particles within the respiratory tree. So to orient you to these figures here, these are basically figures on the x-axis, you have rest and exercise. And on the y-axis, you have retention of particles within the lung. So the take-home message of this slide is 2.5 hours following exercise, shown by panel A here, and 24 hours following exercise, shown in panel B here, is that retention of particles within the lungs is less. So you may intake more, but you may retain less. So again, like I said with the previous slide, it's just that the relationship is murky. It's not as simple, I think, as somehow people like to think of it. So currently, what do we know about exercise and air pollution? Well, we know with some studies conducted in an ambient environment that lung function might decrease. So what we have here is we have 2 figures that basically are different indications of how well your lungs are functioning. And what you can see here on the x-axis is that there's a low PM environment and a high PM environment. And what the individuals did was they exercised for 30 minutes at a reasonably high intensity, and lung function was measured before and after exercise. And so what you can see is that in the low PM environment, lung function changed less than in the high PM environment. So what you can take from this is that exercise in air pollution that contains higher levels of particulate matter may decrease lung function. And similarly, we can see lung function decreases when individuals are exposed to ozone. So what we have here on the x-axis is an increasing concentration of ozone, and again, the percent change in lung function. So what you can see from the 3 lines here is that when individuals are exposed to ozone, you get a significant decrease in lung function. And this decrease is dependent on concentration. So the higher the concentration of ozone, the more the decrease in lung function. So in addition to lung function decrement, there's also potentially inflammation that can occur within the lungs. And so for this particular study, individuals cycled for an hour on a high or low traffic route. And the outcome that they chose to indicate lung inflammation was something called the fraction of exhaled nitric oxide. So you just breathe into a device, and it's an indirect measure of certain kinds of inflammation within the lung. And so what they found was that there was an association between an increase in particulate matter and an increase in this marker of inflammation. This study, I'm not super happy with the study design, so I wouldn't hang your hat on that. But I think it just suggests there may at least be some kind of lung inflammatory response to exercising in pollution or exercising in traffic. And then similarly, when individuals exercise in a high ozone environment as well, they experience markers of inflammation within the lung. So this graph contains a lot of information here, but basically what you have is air exposures in black and ozone exposure in gray. And well, I'm not going to belabor the point of explaining what these markers are. What you can see is that basically in ozone, these markers increase, and a good number of them are all markers of inflammation within the respiratory tree. So what we can say is that when an individual exercises in an environment with high levels of ozone, they may also experience inflammation within the respiratory tree. So in addition to effects that we see within the lungs, you can also get effects that occur within the cardiovascular system and occur beyond the lungs into the blood vessels. So endothelial function, it's basically, the simplest way to think about it is, it's a good measure of how healthy your blood vessels are. And you really want healthy blood vessels that respond to changes in blood flow to decrease the work on your heart. So having good endothelial function is a really good marker of health. So what this particular research showed in the left graph here, we have again a low PM and a high PM environment. And the black bars are pre-exercise and the gray bars are post-exercise. So what this panel on the left here is showing, that's showing the diameter of one of your blood vessels in your arm. And what you can see is that following exercise in a high PM environment, the diameter of this blood vessel decreases. So it's undergoing vasoconstriction. So your blood vessels are becoming narrower. Then the bar to the right here measures something called flow-mediated vasodilation. And that's sort of a long word for basically just saying how well your blood vessels respond to changes in blood flow. So if they respond well, that's good, you have healthy blood vessels. But what you can see again is that following exercise in a high PM environment, this measure of blood vessel function decreases. So it means maybe that your blood vessels aren't functioning as well. But again, with this particular study, I have reservations in the way that they measured and analyzed this blood vessel function. So again, I wouldn't hang my hat on this particular body of this research study. But I think, again, it alludes to the fact that we could see effects that go beyond the lungs. I'm an exercise physiologist, so exercise performance, at least of some of the people that I work with, is important. And I'll just touch on this very briefly. So what they found in this particular study was that when individuals exercised in a high PM environment, that exercise performance was decreased. So this is important for both recreational and competitive athletes, that when you're exposed to air pollution, you may experience a decrement in exercise performance. And similarly, when individuals are exposed to ozone, they can experience a number of reductions in exercise performance, and you can measure that in a number of different ways. But really, a lot of the performance implications related to ozone can be attributed to the increased respiratory discomfort that people feel when they're exposed to ozone. So if you can't inspire as much, when you get to those higher exercise levels, it's really challenging to actually exercise maximally. And so I think in addition to what happens when you're exposed to air pollution during exercise, we have to think about the environment prior to exercise as well. I'm not sure how familiar a lot of you are with the air pollution literature, but there are a number of physiological effects that occur that will actually persist beyond the end of exposure. So if some of these symptoms or some of these physiological changes persist, they could manifest during exercise. So a study that was part of my thesis that I'm not going to touch on today, we essentially exposed individuals to diesel exhaust prior to exercise and then had them perform an exercise test. And what we found was that when individuals were exposed to diesel prior to exercise, their heart rate was significantly elevated during the exercise trial. And this was elevated by about 6.5 beats per minute, which for you and I, okay, it's an elevated heart rate, great. From a physiological perspective, I think it's really cool. But I think where this becomes concerning is if it happens in clinical populations, which we don't know if it does, when they're exposed to diesel, but if it does, this additional cardiovascular strain, they might not accommodate as well. So it may sort of manifest itself as maybe angina, but we don't know, that's all just speculation. And then I didn't include much of the literature on this, but there is a good body of research to suggest that if you're exposed to carbon monoxide and traffic-related air pollution or particulate matter prior to exercise, this can be manifested as angina during exercise, so that's chest pain, or myocardial ischemia, which is reduced blood supply to the heart. So it's sort of what happens before you or while you're having a heart attack, basically. So this is great. We know that all these things happen during or may happen during exercise. So what do we do? Do we tell people to not exercise? And at least in places like Vancouver or some parts of the developed world, if it's only a bout of air pollution, sure, we can tell people to not exercise during the bouts of air pollution. But there are also parts of the world with consistently poor air quality where this may not actually be a reasonable thing to do. And it may actually result in physical inactivity, which again, we mentioned is basically a big potential contributor to death. So that was sort of the impetus for my thesis. And really, I think the single, I don't know if I want to say the single most easiest way that you could advise people, but one really important way that you could suggest, thing that you could suggest for people to do is, how about you modify how hard you exercise? Because generally, there is the assumption that, you know, when you exercise, you increase all of these 5 factors that we spoke about. And again, like I said, when you exercise, this will increase the dose. So if somebody is exercising harder, the greater inhaled dose may result in greater physiological or health effects. So exercise intensity may increase all of the 5 factors that you see on the screen there. And whether this results in greater physiological or health effects, we don't really know. So essentially, you would want people to slow down or reduce their exercise intensity to reduce the dose of air pollution that they're receiving if we assume that this results in greater physiological effects or health effects. But, like I mentioned earlier, it's not that simple. In my eyes, it's not that simple. So then why would you actually not want people to slow down? Well, there's a reasonable body of research that suggests if you exercise harder, it has greater effects on longevity, so you're less likely to die. And like I mentioned in the previous slides, as your exercise intensity increases, the three factors that we touched on earlier, highlighted in these points here, increase more. So with higher intensity exercise, you're more likely to experience hypotension, so a low blood pressure. You'll get more dilation, bronchodilation, so dilation within the respiratory tree, and greater improvements in arterial compliance and distensibility. So based on those assumptions, you could put, as you increase exercise intensity, you could possibly offset the effects of air pollution more. So that led me into the main focus of my PhD work. And the main question of my PhD work was, does exposure to diesel exhaust during exercise alter physiology, and are these effects potentiated by exercise intensity? And the systems that we assessed this in were the systems that are typically affected by diesel exhaust and or particulate matter exposure. So the cardiovascular system, so heart, blood vessels, the respiratory system related to the lungs, the systemic inflammatory responses, as well as the autonomic nervous system, so that which controls the regulation of the heartbeat. And so to focus on the primary objectives of my thesis, they were basically to determine if the four systems that we just spoke about, if their response to exercise between diesel and filtered air was different, or if they were potentiated by exercise intensity. So does exercise intensity make these physiological responses worse? And so for this particular study within my thesis, 18 males participated within the study, and they were recreationally active. So to be a member of my study, they basically had to be undertaking Canada's physical activity guidelines, which is 150 minutes per week of moderate to vigorous exercise. So not anybody who's super fit, not anybody who's super unfit, but it's healthy people. And so for this particular project, each person had to attend the lab on 7 days. And so the first day, they performed a maximal exercise test, and this is to characterize the individuals as well to find out the highest intensity that they can possibly work at. And then during this day, we also familiarize them with all the procedures that we'd be doing on the subsequent days. For the remaining 6 test days that you see highlighted here in days 2 to 6, individuals either rested, they performed low intensity exercise, or they performed high intensity exercise. And they performed this in either diesel exhaust or in filtered air. And so these 6 test days, they all occurred on different days. They were all separated by 7 days, and they all occurred in a random order. And then additionally, the people that were being tested, as well as the research assistant, were blinded to the condition that they were being exposed to. So we conducted our research in a lab at VGH, Dr. Chris Carlston's lab. And the exhaust was produced by a diesel engine that was essentially bled, filtered, and diluted into the exposure chamber. And we controlled the concentration of particulate matter at 300 micrograms per cubic meter. And so when individuals rested, like it suggests, they rested for a 30-minute period. And they had the same breathing setup as when they were exercising. During low-intensity exercise, individuals again cycled for 30 minutes, and they cycled at 30% of their maximum power. And I like to equate that with a leisurely ride around Stanley Park. That's pretty much, I think that hits the nail on the head with that. So it's just a nice, relaxed, nobody's out of breath. It's a pretty chilled ride. And then during high-intensity exercise, individuals again cycled for 30 minutes, but at this time at 60% of the power or their maximum power. And this is basically the most that you can sustain for about 30 minutes. And I can attest to the fact that this was pretty maximal for a few people, because I almost lost my voice a few times trying to encourage them to keep going. And so for this particular study, we measured variables before and after exercise, as well as during exercise. So we measured markers such as VE, which is minute ventilation, so that's how much you breathe. We measured tidal volume, which is the depth of your breath. We measured how often you breathe. Then we also measured oxygen consumption, so how much oxygen you use when you're exercising, as well as a few other variables that give us an indication of metabolism and cardiovascular function during exercise. And so for these particular variables, we averaged them over the course of the exercise bout. And then what we did using the means of this is we estimated something called work of breathing. And that's basically how hard your respiratory muscles are working so you can breathe. And then how much oxygen they consume when you're doing exercise. So then I think what's particularly important is we asked people how hard it felt when they were exercising at the very end of exercise. And so essentially what we do during the last minute or two of exercise is a scale that they look at. And we say, okay, rate on this scale how your legs are feeling and how your lungs are feeling. Because they don't always feel the same, especially potentially when you're exposed to air pollution, one may feel different to the other. And then the variables that we measured before and after exercise. So we measured that after exercise, we measured immediately after, 1 hour and 2 hours post. So this particular study was only in the acute setting. And I think that's really important to bear in mind in the context of these results. But you can't do everything. So we focus on the acute model. So what we did was we chose variables that, again, are part of the 4 systems that I mentioned earlier, and that are basically likely implicated by exposure to either diesel or particles within the diesel. So we measured blood pressure. We measured something called heart rate variability. And that's an indirect measure of the electrical control of your heart. So it deals with rhythm and beat of the heart. We measured flow-mediated dilation, which again is another example of vessel function. And then we measured some markers in the blood that give us an indication of inflammation, as well as other indication of vascular function. And then finally, we finished off measuring something called FeNO, which is the indirect measure of lung inflammation. And we measured pulmonary function, so how well your lungs are functioning. So, like I alluded to, we measured data during and pre and post exercise. So for the data that we took the average of over the 30 minutes of exercise, we did a 2x3 repeated measures ANOVA. And then for the data that we collected before and after exercise, we did a 2x3x4 repeated measures ANOVA, with the 4 being the time points at the end. And so what did we find? In the next slides, I'm going to walk you through the data that we found during exercise. So perceived exertion, that's me asking you how hard it feels when you exercise. So what you can see on the graph, and there's going to be a similar setup with the subsequent graphs too. On the x-axis, we have the filtered air environment. On the y-axis, we have diesel exhaust. Sorry, in the black bars, we have diesel exhaust. Then on the y-axis, we either have how exerted your lungs feel or how exerted your legs feel. And so what we found was a mean effective exposure, which suggests that when individuals were exposed to diesel exhaust, they experienced about a 0.9 increase in perceived exertion. So that's definitely enough to slow you down considerably if you're controlling the pace of exercise that you're doing. And this particular outcome measure, if it's also exhibited in clinical populations, may be exacerbated further, so they may be more likely to terminate exercise prematurely and or have an adverse health effect. So the next number of slides that I'm going to show you refer to the breathing data and the metabolic data that we collected. So this particular variable, it's called the respiratory exchange ratio, and I don't think you necessarily need to know what that means, but it gives us an indication of metabolism, basically. or what kind of fuels that we use during exercise. So I think the take-home point of this particular slide is that when individuals are exposed to diesel exhaust, metabolism may change slightly. So the RER goes down, which may represent an increased utilization of fats for energy production as opposed to carbohydrates. And so this and the next three graphs that we touch on, there I found a similar effect across the three variables. So this particular variable is essentially how much you breathe every minute. And so what we found was, let me orient you to the graph first, actually. So we have the resting condition, low intensity, and high intensity exercise. We have filtered air in the white bars and diesel exhaust in the black bars. And on the x-axis, again, minute ventilation, which is basically how much you're breathing. So what we found was that only during low intensity exercise, minute ventilation is elevated in diesel exhaust. But we didn't see this during high intensity exercise, and we didn't see this during rest. So if you exercise moderately in diesel exhaust, you might breathe more, but not if you're exercising harder or not if you're resting. And we found a similar effect with oxygen consumption. So how much oxygen you consume when you're exercising. And again, during low intensity exercise, shown here by the middle bars, during low intensity exercise and diesel exhaust, oxygen consumption will significantly increase. But this again doesn't happen during rest, and it doesn't happen during high intensity exercise. So what you're probably sensing is it's not as linear, the physiological responses, as we may have liked to have thought originally. And I'll skip over this one for now. So we did find that minute ventilation increased, RER decreased, and also as well, you basically find the task to be more difficult because your perceived exertion increases. But we didn't find any effects on the depth of breath or the frequency of breath. Now, they were approaching significance. So, I mean, I think there is an effect there. We just didn't have an adequate sample size to find statistical significance. And the same with estimated oxygen consumption of the respiratory muscles and work of breathing. So there are some what I think they're cool physiological changes that are occurring when you exercise acutely in air pollution. So we're going to switch gears now to the data that we collected before and after exercise. And so the first one that I'm going to talk about is plasma nitric oxide. And this is a really important measure in regulation of vascular function. It plays a role in vasodilation. So to orient you to this graph here, because there's a lot of information, what we have on the x-axis are the 4 time points. So before, immediately after, 1 and 2 hours post-exercise. The panel here, we have rest. B, we have low intensity exercise, and C, we have high intensity exercise. The solid lines are diesel exhaust, and the triangles are filtered. The triangles and slashes are filtered air. So what you can see from these graphs, just focusing on B and C here, is that following both exercise conditions in diesel, plasma NOx increases. So the amount of circulating nitric oxide within the blood increases. And that's to be expected because when you're exposed to diesel, it contains plasma NOx as well. So there's probably a little bit of, it's probably related to the inhalation of NOx within the diesel. So endothelin is a vasoconstrictor. So it sort of counteracts what nitric oxide does. They sort of work in concert together. One dilates, one constricts. So originally we thought that this particular marker would increase following exposure to diesel. But what we found here, we found a two-way interaction. So we found an exposure by time interaction. So what you see in these particular time points is the graph just represents the data collapsed across exercise intensities. But what you can see here is that 2 hours following exposure to diesel exhaust, endothelin 1 was significantly lower. I think it's, while it may be statistically significant, it's only a very small amount. So I don't think it's anything particularly concerning, but like I suggested, it does go in opposition to what we originally thought, because we thought that endothelin 1 would be increased because diesel as well as particulate can cause vasoconstriction. So some opposite findings there to what we anticipated. And then what this is here, this is a marker of endothelial function. And for this particular variable, we also found a two-way interaction. So we found an exposure by intensity interaction. So at these particular points here, it's collapsed across time. So this is, again, a measure of how healthy your blood vessels are and how well they're responding to changes in blood flow. So good endothelial function is good for health. And so our post-hoc analysis showed that only during low-intensity exercise, endothelial function was significantly less in diesel exhaust compared to filtered air. And again, we have diesel exhaust in the triangles with the slashes, and then we have filtered air in the solid lines and the squares. So we only saw this effect during low-intensity exercise, but not during high-intensity exercise or rest. So then, the other things that we measured, so we found that diesel exhaust did not affect and exercise intensity did not potentiate some of these other markers that we measured related to the four systems that I was interested in. So no effect on blood pressure, heart rate variability, complete blood count, no effect on lung inflammation, pulmonary function. And then all of these things on the right here are just other markers of vessel function. So no effect on any of those variables. But to summarize the results that we did found, to bring it all back together again, because I'm aware that that was a lot of information, particularly for anybody that doesn't have a big physiology background, but just to bring it all back together for you. So we found that RPE, so the perceived exertion, how hard the task is, we found that it was greater in diesel compared to filtered air. We found that RER, so an indication of metabolism, fuel use was less in diesel exhaust. And then only during low-intensity exercise in diesel, minute ventilation, oxygen consumption, and carbon dioxide production was significantly more in diesel exhaust compared to filtered air. And this didn't occur during high-intensity exercise or during rest. So the data that we measured before and after exercise. So plasma NOx was significantly greater in diesel compared to filtered air. And this was following exercise, but not following rest. So you have higher plasma NO. Endothelin 1 was significantly lower in diesel, 2 hours following exposure. And then finally, blood vessel function was significantly lower in diesel exhaust, only on low-intensity exercise days, but not on rest days or on high-intensity exercise days. So that I think for me, the best part about writing my thesis was speculating on why some of these things might be happening, because it wasn't following the typical linear pattern that we would think. You would think that, well, if there's an effect during low intensity, you would see a similar effect during high intensity or more of an effect. So I had a great time speculating on why some of these physiological changes occurred. So why would oxygen consumption increase more in diesel exhaust compared to filtered air? Well, there's a possible role of catecholamines, and these are just, I guess, these are markers within the blood that play a role in a number of different things, and they're produced in the kidney. But essentially, when rats are exposed to smoke, they have an increase in something called plasma norepinephrine, which plays a role in the activity of the nervous system. And you can see the increase in plasma norepinephrine here in this table that I've just highlighted. So there's a significant increase with smoke exposure. Well, if you have an increase in plasma norepinephrine, you'll actually have an increase in oxygen consumption as well because it alters metabolism. So maybe, we don't know, but maybe the exposure to diesel exhaust could have played a role in elevating catecholamines, which could influence oxygen consumption. So why would minute ventilation, so why would how much you breathe increase more in diesel exhaust compared to filtered air? Well, there could be a role for something called irritant receptors, and these are receptors within the lung that when they're stimulated, they can respond by increasing ventilation. So it's possible that the irritants within diesel exhaust could cause an elevation in ventilation or how much you breathe by stimulating these receptors. So then the golden question for me was, that's great. We have a lot of exciting ideas about physiologically what could be going on, but why are some of these things happening during low intensity exercise but not high intensity exercise? And so I'll focus on minute ventilation, so how much you breathe for this particular one. Well, so there are some modeling studies to suggest that when individuals exercise or increase their breathing, there is more deposition in the peripheral part of the respiratory tree, so further down in the lung. But irritant receptors, so these receptors that may respond to stimuli by increasing ventilation, tend to be located more centrally, so in the bigger airways. And so this is just one hypothesis, is that maybe the more peripheral deposition of particulate bypasses the irritant receptors centrally. Just one idea, but kind of a neat one that fits with our results. So switching gears now, is that we did see an elevation in plasma NO following exercise. And like I alluded to earlier, generally speaking, plasma NO is involved in vasodilation, so it's usually a good thing in certain situations. But the elevated NO that we saw in our particular study, I'm not sure if it's as black and white as saying more NO is better. And the reason for this is that we know that NO can combine with the free radical superoxide to form a powerful oxidant known as peroxynitrite. So, and again, this is all just speculation. It's possible that this elevation in NO that is from the diesel exhaust, so if that's elevated and we happen to have more superoxide, you may actually get more oxidative stress or oxidants. And there is a little bit of research to suggest that when individuals are exposed to diesel exhaust, they will actually produce more of the superoxide as well. So what I am suggesting is that the diesel exhaust is sort of maybe the perfect storm. So you have more NO, but you may also have more superoxide. So they combine potentially to cause more oxidative stress. And I think in the interest of time, I'll just go through this quickly. Okay. So to keep on time, what are the conclusions and implications of my thesis, or at least this project within my thesis? Well, the first one I think is related to performance and participation in self-paced exercise. So if when you're exercising in a polluted environment, it feels harder in both your lungs and your legs, you're less likely to participate at the same intensity. So if you're a competing athlete, that'll probably impair performance. If you're an individual Joe Schmo just exercising outside, you're going to exercise at less of an intensity as you would potentially like to, so may not get as many health benefits or as many training benefits. Then exercise intensity. Should you slow down? Well, and bearing in mind this is a study that only looks at one model of air pollution, so we use diesel exhaust, and we only look at stuff in an acute setting. But our data doesn't necessarily support the notion that if individuals slow down, they'll have more of a health benefit. So I would suggest that based on this data, there may be no additional benefit to slowing down during bouts of high air pollution. To finish up, I'd just like to thank the organizations that supported me and my research, as well as everybody that was involved in the last 4 or 5 years of this project and my thesis. So, and thank you for the opportunity for being here today. Thanks. I'm happy to take questions.
Yeah, I've got the mic here, Luisa. Thank you very much. I think I learned a lot of big words I didn't know before. Does anybody have any questions?
Thanks, Luisa. Very interesting about the low intensity exercise levels and the ventilation indices being increased. Did you look at the cardiac zone? You know how we are to exercise within that zone for optimal results, I guess.
Yeah.
Is that correlated with the level of intensity of exercise? Did you look at that?
Yeah, so I guess what we wanted our exercise intensities to be were similar to the recommendations provided by the Canadian Society for Exercise Physiology as well as the American College of Sports Medicine. So our intensities correlated with the high intensity was more vigorous and the moderate intensity, or the low intensity was considered moderate to low intensity recommended by these organizations. So I would say that the low intensity is probably more likely the intensity that clinical populations will be using because they just can't exercise as vigorously. Yeah, so it is, that was sort of part of the decision for choosing these intensities.
I'm going to ask a question. How possible is it to really be blinded to 300 micrograms per meter cubed of diesel exhaust?
Yeah, well, there is, and obviously, that's a big potential confounder. There is research out of Chris's lab to suggest that people are appropriately blinded. This might be a little concerning, but there's definitely a residual smell in there from probably from some of the VOCs that have left a residual smell in there. So, I mean, there is an underlying smell of diesel in there, which may make it less obvious. I think as well what I saw was that there was a range of people who were sensitive or not sensitive. And I would say and I didn't actually ask people, which regrettably I should have done, ask them if they knew what they were exposed to, but I would say only one person actually could probably know. But how that perception may or may not affect some of the physiology that we were measuring, I mean, maybe it would. And you definitely always take that chance. But we did I didn't even know what their condition was. It was just the engineer running the chamber. It was a physiology. Oh, there is. Okay. And it was physiology heavy, but I did ask if that was okay.